we just want to try and bring a lot of experience to the table and are looking forward to an engaging conversation tonight. So to ensure we have this engaging conversation, I just want to make sure we go over some housekeeping points. So first, we want to make sure that you're in this event and having a full experience. So we're going to encourage all of you to turn on your video feature. So this will allow for more of a connective discussion and an immersive experience. Note that we're obviously going to be recording the session. I'll see what we can do to edit a little bit, but we will be recording the session for educational purposes and can share the recording with you. All lines are going to be muted upon entry, but we will unmute towards the end of the session to allow for open dialogue and questions. We plan on first going through the questions that all of you had sent to us ahead of time. But if you have questions throughout the session, please feel free to put those questions into the chat box. Myself and Katie Flynn, our programs committee chair, will also go through the questions and try to monitor throughout the session. We'll also try to get through as many of the questions as you have, but like I said, if you want to chat, if you want to also use the reactions button at the very bottom, where you can choose to raise your hand that way, you can do that, or do any of the emojis that you see below. We'll keep an eye on that to just make sure we know you've got a question. We'll try to get to you. And also, if you've logged in with a phone number, please see if you can get into our chat box and just let us know who you are. If I don't get a response from you, I might try and reach out to you directly via chat. Without further ado, that was a great kickoff. So here we go. Monique, I'm going to hand it off to you as our student activities chair.
Hi, everyone. Thank you so much for joining tonight. So we do welcome you here to have open dialogue and conversation. And throughout the event, before we head into introductions, we really want to encourage that. This is really for you and for your benefit as recent graduates and students to really kind of levitate what you need and get out of it in terms of your skill sets and what advice that you need. So feel free to chat us in the actual chat box or send us any sort of questions that you might have. And with that in mind, we'll get started with the first slide. Amy went ahead and she's introduced us, and this is a little bit of background as to who we are and what we stand for as our mission. And tonight we have our program lead, Katie Flynn, myself as moderator, and Sarah as our volunteer for the student committee. So I'll go ahead and give them a minute or two to introduce themselves.
Hi, everyone. As Monique mentioned, my name is Katie Flynn. I am the programs committee chair for New England Himss. So within programs, we are responsible for putting on and doing all of the background and organizing a lot of these great webinars that we've now sort of moved into from in-person events to webinars over the last 7 or 8 months. And my day job is I am a senior account executive at Queen Consulting Group. We're an IT healthcare staffing company.
And then here myself, I'm Monique Czulewicz. I currently work at Mount Auburn Hospital full-time as an Epic analyst. I work hands-on with their revenue systems. Currently, I am a student. I go to school in the evening at Northeastern University for their Informatics program, and I volunteer with New England Himss. So everyone here is a volunteer and has generously donated their time and efforts to make this event happen. So thank you, everyone. And next we have Sarah.
Hi, everyone. I'm Sarah Khalil, and I'm a first-year graduate student in Northeastern's Health Informatics program, and I'm currently serving as a volunteer. I'm part of the Students' Activities Committee.
Great. Thanks, Sarah. So we'll start off. We have Kevin.
Hi, everyone. My name is Kevin Nguyen. It's nice to meet all of you. So I am currently working as a business analyst at SMC Partners. And before that, I was a student at MCPHS University, where I got my undergraduate degree in biomedical informatics. One of my professors my freshman year was very involved in Himss, and she took myself and my classmates to one of the meetings, and I've been involved ever since. So I was a scholarship recipient back in 2019 for the Dvora Brodie Scholarship Program. And then I am now also pursuing my MPH degree and will be graduating at the end of next month.
Fantastic. Thanks, Kevin. Next, we'll move on to our next panelist, Sarah.
Sorry, I was on mute. Hi, everyone. My name is Zhang. You can call me Sarah. I'm a 2019 graduate from Northeastern's Health Informatics program. I'm currently working as a business intelligence analyst at CCA, Commonwealth Care Alliance. I've been volunteering at Himss since 2017. I worked in education field for several years before switched into healthcare. The program and experience with the Himss really helped me greatly to get me where I am today. So it will be my pleasure to share my experience with everybody. Thank you.
Thanks, Sarah. Our next panelist, we have Renee.
Hi, everybody. My name is Renee Broadbent. I am the New England Himss Executive Board Secretary for the organization. I'm also an undergraduate adjunct faculty member for Southern New Hampshire University, where I teach several classes, including project management, organizational change, and actually this session I'm leading a group of students through their capstone as they get ready to graduate from the university. During my day job, I am a senior manager for vCISO advisory services with Wolf & Company out of Boston.
Fantastic. Thanks, Renee. Next, we have Tom.
Hi, I'm Tom Agresta. I am a family physician and board certified also in clinical informatics. And I am a professor at the University of Connecticut in the medical school. I also do some clinical informatics at the Center for Quantitative Medicine at UConn. I have been involved in helping to set up the actual discipline of clinical informatics and work with the state of Connecticut in attempting to help move forward on health information exchange activities and work with a lot of things around analytics, and had the great opportunity of actually having a student intern, Kevin, actually work with me at some point in the past. So there are opportunities to sort of find opportunities with us faculty and folks in the field. So I look forward to hearing from some folks.
Thanks for highlighting that, Tom. And last, we have Dan.
Hi, everyone. I'm Dan Flanagan. I'm a program manager in IT for the EPIC team at Boston Medical Center. I'm also an instructor at Brandeis University's RAB School for Graduate Studies in Health Data and Electronic Health Records. I've been a Himss member for about 8 years, and this is my first time volunteering and serving on the panel. Nice to meet you all.
Well, we have a great group of folks with us here tonight, and we're going to just jump right in and have our open dialogue with Q&A. And this will be starting off with our students. And again, towards the end, we'll jump into faculty sort of questions, but just to highlight that it's not very structured. It's really just jump in and chime in, and let's hear about it. So to start off, Kevin and Sarah, a big question that we've had from our audience is how to really transform during this pandemic with everything going on. Do you have any sort of advice or guidance on how to stand out above the rest with no sort of experience?
Sure. So to speak to that a little bit, one of the things that is like very minor that I feel like goes a very long way is keeping up to date with current events in, the sector of work that you want to go into. So that way, when you're networking or when you're speaking to people and, you're talking about all these things that you have knowledge of, it really shows and comes through, and it can really set you aside from other people. So, especially as like a younger student, if you say, you're a recent graduate, you don't have that much experience yet, but you're speaking to all of these things that are very relevant, that's going to be something that's memorable. So that's one thing.
Sarah, do you have any other sort of feedback on that?
Yeah, Kevin really made a good point. My suggestion is, like, besides the network, for the current students, if you don't have much experience in the industry, what you can do is to really evaluate yourself, like where you are, and look at the direction where you want to go. And like, don't have to be too specific. And then you find the gap and you fill the gap. So like, I take myself as example. Like, I started looking at the job descriptions like year before my graduation. So look like what jobs I'm interested in doing after I graduate. And then I started learning all those, skills that I can learn. So you can do that during pandemic, as you have a lot of time, like sitting at home, maybe you can learn something and improve the skills. Yeah.
Fantastic. Great. And during your search, what resources did you use the most? Were there certain websites or links that you gravitated towards that you found to be helpful?
Myself, I use LinkedIn the most, and then very lucky for me, because my job was referred by one of the Himss advocates, and then also my classmates. So I actually got my job like right away after my graduation. But I do recommend to use LinkedIn and Himss as like resource, like network, and then you can connect through people who knows good opportunities. Yeah.
Yeah, so similar to Sarah, I mean, I started off like with your typical, Google searches on LinkedIn, Indeed, ZipRecruiter, all those different types of sites. But I mean, nothing is going to be able to compare to networking. So through Himss, I joined the mentorship program, and even just trying to do informational interviews with people working in the healthcare space in my local area, like not even setting up appointments to say, hey, do you have any positions open, but just asking them questions like, oh, did you know this is what you wanted to do? How did you get involved in this space? What are some things that I can do to kind of follow that? And eventually, through networking and Himss, that's actually how I got my job here as well. So networking is going to be your best bet, guaranteed.
Thanks. So both of you, in your current professional role, what graduate classes have helped you the most, and why?
Kevin, you want to go first?
Sure, I'll start. So yeah, so I am almost done with my courses for my Master's of Public Health, and the two that I think stand out, the first class that I took is a health informatics course, which kind of gave me more background info and more information about health IT, data management, and data analysis. And those are things that could be applicable really in any field. I mean, there's data on literally any topic out there, and it's just a matter of finding people who know how to leverage it and what to do with it. And the other thing that I found was really helpful was for my program, I had to do an internship for a semester. So over the summer, I interned with the Worcester Division of Public Health, where I did some data analysis on how, temporary homeless shelters are effective during the pandemic, and getting that real world experience and seeing, what kind of stuff goes on in the background is going to give me way more exposure than say something in a textbook. So those two for sure.
I agree. It sounds like you have a balance of going ahead and using those skills and just reaching out for something that's current and fresh, something that will fill the gap and what people are looking into as a solution almost. That's great. Everybody needs help.
Yeah. For me, I would say project management class is the most helpful, because I'm utilizing what I've learned from that class on a daily basis. And besides what Kevin mentioned, the healthcare informatics class that provide like really good foundational like knowledge to the background of the healthcare, and I can pick up what I do like from work easily. Because I have all those knowledge in mind. And then also I took a couple of the programming languages like SQL and R classes during in the program, which because I'm very technical oriented, so that it helps me tremendously to create reports and the dashboards for my clients, and then cut short the delivery time. Yeah, thank you.
Fantastic. So now that you've actually gone ahead and you've obtained a job that you're happy with, during your job search, which do you use the most? Whether it be reaching out to someone or so forth. Actually, we touched upon this? No, I'm sorry, we touched upon this already. Too many questions. Next question, tell us the best part of your job. What made you apply? Was it personally driven or skill set driven?
Sure. So I guess I'll go ahead and start. So like I was saying before, networking was, the key to how I actually went about applying. I met Steve Ruth through Himss, and it wasn't until I met him and got the opportunity to have a one-on-one talk with him and came into his office at SMC that I came to see, like, wow, this is a really great place. And it wasn't, my situation, I think, is a little bit more unique in the sense that it wasn't like I saw this position online or I didn't even know if they were hiring. I just went in and spoke with the CEO, and we just had a really good discussion about SMC's mission and whatnot. And that was kind of where I was like, wow, they're really making a difference with the kind of stuff that they're doing. And based off of my internship with Tom that I had at UConn, that was the moment where I was like, I want to work with, data analysis where I can actually make an impact on communities. And I felt like SMC was a great place that I could do that. So, and ever since then, it's been awesome. I mean, I've had super supportive coworkers, and I've really gotten a chance to develop some of the more technical skills in working with data and seeing how it applies to the clients and whatnot.
Great.
All right, my turn. Yeah. So the best part of my job is that it really enables me to manage or participate in the whole life cycle of the project, which involves like business requirement gathering, like write the documents and then even write a code for the reports, and then do a data analysis and then do data validation, the QA and all that. So I'm involved in all those phases, so that enables me to understand what the clients want and what CCA, like my company, is doing to help bring the value to the healthcare and to our patients. I really enjoyed both like communicate with my clients, also like to work very closely with the data and do a data analysis and try to bring my insight into the report for the client. Yeah, that's my
feedback. Thank you so much, Sarah.
Thank you.
Katie and Amy, do we have any questions in the chat?
We do not.
Okay, so we'll move along.
We have one more. Oh, sorry. No, that was actually an internal with the chat. It's a discussion that I think Steve Ruth and Kevin, and the question was, what made you stand out after networking with in regard to where you interned? I think that was one for Kevin.
Made me stand out in regards to networking. I mean, like I was saying, I didn't go and approach people with the mentality of, hey, I want something from you, or hey, like, do you have something for me in terms of a job? It was really just like, I want to get to know as many people in the field as I can and see what I can learn from them. And then if something happens and an opportunity presents itself, and I would hope that I made a memorable enough impression that they would then reference me for something like that. So.
Perfect. Yeah. Or the question could be, what could make you stand out at a networking?
I mean, like I said before, definitely keeping up with current events. So, you have some talking points, and basically having an idea of what it is you're looking for, essentially developing your story. My mentor from the mentorship program, he really helped me establish that of, laying out the path of when I'm meeting someone new, in order for them to get an understanding of who I am and what it is that I'm looking for, what kind of field I'm in, to give them like a really good backstory of, what I went for in school, why I find, that topic interesting and what I'm looking for in the future.
Right.
So.
Great. Thanks, Kevin. This is probably for Kevin or Sarah as well, but is Himss a good source to find a preceptor?
Yeah, I mean, I think Himss is a great resource. I mean, the people involved are people who have years, if not decades, of industry experience that, recent graduates just aren't going to have access to, and just getting the opportunity to speak with them and, pick their brains and see what it is that, they can teach us is invaluable. So.
Great. Thanks, Kevin. Those are all the questions for right now, Monique.
Oh, fantastic. Yeah, to add to that, to the networking piece, just off the top of my head. So when you are at these networking events, you do meet people. Once we go back to normal life and we're in person again, one thing that I did do that I found to be helpful was that follow up with those people at the next event. Say, hey, by the way, we had a great discussion here. I found this other event that New England's Hymn is doing. Are you attending that as well? Meet up with them for coffee quickly, 5 minutes before the event, 10 minutes before the event, and just chat with them and genuinely see how they're doing. People are in different areas of interest in terms of their jobs and their skill set and talent. So there's always more to fold into that conversation and also learn for yourself, which I found helpful. Okay, so right now we have a lot of these questions answered by Kevin and Sarah. Does any of our professors and professionals have any sort of feedback based off of these questions that we had asked earlier?
So I just want to make a follow up on a comment you made, Monique, about, in-person events when we eventually get back there. One of the tips that I give people, and someone gave it to me and I did it and it works really well, is a lot of times when we have events, right, we kind of go with people and maybe stick with the same people that we're with. And that really kind of limits your ability to move around the room. So one of the things you can do is there's breaks and there's lunchtime and it takes a lot of courage the first time to do this, but once you do it, it gets to be easy, is go sit at a table of people you don't know and introduce yourself. And then what you'll see happens is they'll start to introduce themselves. And that's a great way to meet different leaders in organizations across different aspects of healthcare. And that's one way you can kind of start to make contacts, collect their business cards and do that. It's a very simple thing. It's hard to do it the first time, but once you do it, you can really meet a lot of different people that way.
I would kind of add to that, because I think it's a great comment, Monique, and it's something that I still do. It's not something you should stop doing. But the other thing that I would kind of say is that any of us who've had any success in life have had people that stepped out and offered to mentor us. It's not just simply it's not just simply a one-way street. The folks that are more experienced generally actually really enjoy the process of mentoring people who are interested, legitimately interested. And so expressing interest is something that will get folks to actually be interested in mentoring you and giving you advice. And sometimes the advice is, you know what, I know somebody better to mentor you, or because they're going to be more in line with your skill sets. So I'd say that Kevin got the internship because he showed up at my door saying, I need an internship, but I'll be willing to do all these different things. And I said, well, what do you got to learn something new. And he said, sure. And he did it. And so he got a good recommendation from me because he was willing to do all that.
Yeah, and just to kind of dovetail onto that as well, is I had done a presentation on behalf of another university where I graduated with my MBA, and it was on cybersecurity. And then two of the students in the class who were getting their degree reached out to me on LinkedIn. They happened to live close to where I actually live. And I started connecting with them and started connecting them to people because they were looking for more productive internships. These are people who have changed their career completely. So they're in a little bit of a different thing, but students nonetheless. And so, really working with that mentor to kind of lead you down the path of where you need to go, connecting you with the right person and the right people is really a great way to kind of get you down to a job that you might find of interest, or at least get you exposed to some different folks that can get you there.
I agree.
We did just have a question come through about, this great networking and going up to someone, like you said. in person, but what about in a time of COVID? I feel people will find it uncomfortable when you approach them in person, as lots of people are still preferring the 6 feet physical distancing.
Yeah, I
Just to
think I
chime
can
into
add on to that. Oh, sorry. Kind of going on what Sarah was saying earlier regarding using LinkedIn. I think especially now with COVID, and probably more so than in the past, people are more receptive to electronic communication and reaching out. You know, it's using networking connections from your university, for instance, recent graduates. Definitely helps. I've had, I did health management at UNH, and to this day, I still get, many relationships have been formed using that connection through LinkedIn and using that alumni connection. So don't be afraid to do that, because there is a big network in New England of people in this field, especially, if you went to college around here. So I would recommend that as a good first step.
Yeah. Yeah, definitely the social sites are ways to connect. LinkedIn is a great resource. That's one way to do it. I mean, I think, there isn't a lack of conferences and webinars and things like this that are online now, because everybody's had to move from being in person. And certainly attending something like this, there's a huge, group of people here today. There's over 60 people here. So someone in this group knows something, right? And this is a great way to get exposure to a lot of different people. So I think this is another way to attend these sorts of events to familiarize yourself with with people and kind of what's out there.
Great. Thanks, Dan and Renee. We had one more question come in. It's actually for Dr. Agresta. Specifically, do you have any advice for physicians with a master's in health informatics? I am in IMG, and most employers think I had my license revoked, and that's why I am applying for an entry-level job.
So, IMG, for folks that don't know, is an international medical grad, which basically means that it's harder to get an internship or get into the physician career track. I assume that's what that's referring to, and it is challenging for folks that come in with that background if there's not an understanding of why you're in health informatics. I would suggest just reaching out to folks that are actually doing assistant, associate, chief medical informatics jobs, places where the healthcare career opportunities are there, and see if there's any place in that organization, in that healthcare organization, if that's what you want to try to do with the health informatics background. There are other things you could do. You could actually be working for industry and whatnot. So it's really depending on what your career interests are. Kind of reaching out at that level, is the type of thing you can do. I would also encourage you to join not just Himss, but think about AMIA, the American Medical Informatics Association, because through that track, there is a lot of folks who've got master's degrees in informatics, the more academic elements and things like that. And that might be a place to kind of consider looking for networking.
Great. We had one more come in. I have a good one. I have a question around networking. I currently live in Germany, and I will be getting my degree as well as I move back to Massachusetts in the next year. What are some options for effective online networking? Anyone have any pointers on that one?
Well, I think it goes back to, kind of what we've been discussing, right? So you're transitioning back here to the US. Massachusetts certainly has a lot of opportunities just for Himss in and of itself. But I think, again, connecting through LinkedIn, there are lots of groups on LinkedIn. That's one of the things that I have found most effective is there's different user groups that kind of relate to your field. Sometimes joining one of those, you get to meet other folks. And so I would suggest that is one avenue that you could start to look at.
Thanks, Renee. Okay, Monique, I think we're good to go.
Okay, great.
Actually, Katie, there's a question here from someone. It's for all of them. I think it was probably better for Thomas to answer, because it's specifically related to MD questions.
Yeah, and I'm looking at it. It's related to sort of looking at MD, PhD programs for biomedical informatics or biostatistics. I'm not familiar with the PhD. I mean, the challenge here, I think, is most PhD programs are wet lab PhD programs. There are some in quantitative medical fields. Like I know at UConn, you could probably try to do some work, for example, with Jackson Labs and get your PhD mentorship through Jackson Labs while you're getting your MD at UConn. I think you really need to look at where the schools are connected to research institutions that are going to offer PhDs that might be sort of analytics type of PhDs. But this question gets very, very specific, and it really gets outside my area of expertise per se.
What we can do is actually take these questions, and we have a board actually with the New England Hymns. We can take this and throw it back to our board members and see if they have some sort of suggestion and feedback as well. So thank you for that. Okay. With that in mind, questions are all answered or at least addressed at this point in time. We really want to take it back to the faculty and hear about their advice and expertise. One, to start off for the entire group, just to weigh in on the industry challenges right now. We know that there are a lot of different changes with not being in the office, with not being able to interview necessarily face to face. It's slightly different, that process. How can one stay current aside from all the networking tips that you had gone ahead to mention?
Well, I think, it is a challenging environment to, look for work at this point, right? So you have to rely specifically on online connections, networking, and things like that, and events like this. I think one of the things that my company does, and I think they do a really good job of it, they have been doing a lot of online networking events and recruiting events. And those are always great places to go and look. I mean, we specifically network to schools. So when we're looking for our interns to come in or our first years, we will literally create an event like this at a Bentley, at a Northeastern, pick a school, and we will go out and recruit from those. So if you're looking to go someplace and you're at one of those schools, kind of keep and there's an interest in, risk management services, IT audit, HIPAA, healthcare, look for those types of events being held at your schools, right? And you can do that. And they do all the interviews virtually. So you can get a lot done through those types of interviews. We are now completely remote where I am, and all of our interviews are done through that, whether it's with the recruiting folks or, people that are going to be brought in to kind of interview you through the process. So you can be completely onboarded, and we can have contactless delivery of all your equipment as well.
Tom or Dan, anyone want to chime in?
Yeah, I think just going off of one thing that Kevin mentioned earlier is that instead of going through the traditional channels for, finding a position, whether it's like Indeed or an online posting, really leveraging your connections and trying to reach out to anyone in the field that any friends, any, recent graduates, for instance. One of my students last semester, we actually had an opening pop up, and she reached out to me and just at the right time. And I think, we're in the process of, she's a finalist for a position on our Epic team. And she didn't mention anything all semester about, a position. And then kind of right at the right moment, she emailed me, and the next day the posting went online. So, if she had, gone through the internet, she might not have known. So definitely use those connections and make sure you're reaching out to people.
That's fantastic. Timing is everything. And sometimes just waiting around and contacting someone again. It's funny what opportunities come into place if you're patient.
That's a great point, Monique, is follow up and being patient, right? It's hard right now. I mean, when you're looking for a job, right, we all want to get one, and, and there's expediency, but it does take some time. The processes I've noticed, for us bringing on people is a little bit longer. The other thing is stay current, stay in contact with that individual or the individuals that you're networking with. Don't stop that process, like reaching out once and saying, oh, or whatever. Make sure you have a plan to stay in contact.
I agree. A lot of the people that I have known in the past, I would reach out to them, and I didn't have any sort of experience in healthcare. So I literally would just email a lot of folks with specific types of interest, and really just ask for their time. And I still follow up with them today. Every other week, but every so often, just check in and kind of just let them know how you're doing, what what you've been doing, what you've achieved, and they enjoy hearing that. It's an ongoing conversation, and it's a two-way street at that. So,
Yeah.
The next question we have from our audience is current employer demands. From your perspective, what skills are the most sought out, and has this changed with COVID-19?
Yeah, I think employers, when they're first looking for individuals to come join the company, obviously they have certain skill sets that they're looking for that fit within the organization, so that, your skill set has to be relevant. But I also think, they're looking for individuals that are flexible. I would say that was like the number one skill right now, that you have the ability to pivot when necessary. In mid-March, massive pivoting took place in all organizations, right? We had to get people home. We had to do that. I think as a result, that has created this kind of need to have people who can be flexible with that. I also think they're looking for people who are independent and self-starters, because you're not in the same room with somebody coaching you, next to you. You're not with a big team in a room together when you might be coming into a new company and socializing that way. You're socializing online. So it makes that aspect of, a new job much more difficult. And that, COVID-19 for sure has impacted how that works. And so I think that, when we're looking for people, or when I'm looking to hire someone, I want someone who's self-sufficient. I want a self-starter. I want to know someone, that for, working on something that, we're not sitting next to each other, that they're off and running and doing those kinds of things. So those are some of the skills that I look for in people, is to really be that self-starter and independent.
Yeah, Renee, I would completely agree with that. And I want somebody who I know has a learning style where they can ask me for advice as to where, to look for stuff, but go look up stuff on their own and learn it. And, because the one thing I can guarantee you're going to need to do on a daily basis is learn something new.
Yeah.
And you're probably going to need to teach somebody, what you learned, because I also want somebody who's not afraid to, come and say, hey, I learned this, maybe it's an opportunity for us to do things a little differently. Because that's going to be really critical in terms of building your own profile within an organization. If you can both learn and teach, you're really going to help everybody else around you, and you're going to enjoy being around you as well.
Mm-hmm. I agree.
Yeah, I would agree with that. I think we found that learning through experience is definitely something more, something that we need more than we did before. Our project slate, the urgency of the requests has just gone through the roof, and, don't be afraid to make mistakes. We still kind of dance around, it's healthcare, right? You need to make everything perfect. And we've noticed with COVID that, like, sometimes you just need a solution. You can fix it later, but you really need to get in there and provide a solution for the customer, and you can go back on it later. And we found that the analysts who will jump in and do that are definitely succeeding more than others. So.
Yeah.
I'll give you a great example. Is we had to start telehealth programs like that, and it's amazing. Almost everybody's able to successfully start some kind of telehealth. And I've been trying to get telehealth programs started for years. I couldn't get them started. The need arose. Suddenly everyone is able to do it.
Yep. No, we had the same experience. It took us, I think 3 weeks to stand up at telehealth, where it probably would have taken us 9 months otherwise, and 2 years of delays. So, yeah.
Monique, I have a question from the audience. So,
oh, fantastic.
Is there any advice for a community health ed major that is more of a people person instead of the stat heavy components? I have done well in the technical classes, but my really strong suit is with people skills. How can I pursue this in a master's and future goals while using my strong people skills? I also personally enjoy meeting and talking with people.
Can you do me a favor? Can you just repeat that question?
Sure thing, absolutely.
Because I had a thought process and I just went out. Sorry about that.
Nope, this is someone is looking for advice. They are a community health ed major that is more of a people person instead of the stat heavy components. They have done well in the technical classes, but their strong suit is with the people skills. How can this person pursue this in a master's and future goals while using their strong people skills? They enjoy meeting people and talking with people.
Well, I mean, I think it goes back to, I mean, are you looking to get into a master's program? Is that the question? I'm not sure I'm understanding it, so I want to address it correctly.
Absolutely. Yeah, I mean, the way I read it is that the stat heavy components is not their strong suite. They're not, you know, numbers, but the people areas where they're.
Yeah, so in healthcare, right, there's lots of opportunities to do that, right? So I'm not a math person. You know, if it wasn't for a calculator, I'm not sure how I'd get through the day. But I think that there's lots of opportunities in healthcare, you know, along the lines of project management or just operations management. There's, you know, I'm a big population health person, right? So in the population health field alone, there's a lot of jobs that require you to take that skill and use it to work within a clinically integrated network to, you know, to help clinicians, you know, deliver their, you know, quality metrics and things like that. There's a number of opportunities that, you know, it's great that it's nothing that requires stat heaviness, but actually requires the ability to communicate with people and to have those skill sets. So I think there's lots of opportunity in that area. So hopefully that answers the question.
Thanks, Renee.
Yeah.
Yeah, and just to add on that, coming from like the electronic health record perspective, I mean, you can have a very successful career in EHRs and never deal with statistics. I mean, there are employee analysts around you that deal with that, but it's really not a prerequisite in many positions within healthcare IT.
I would add to that, and that there's a lot of things that require sort of workflow analysis. If you're really good with people skills, you can kind of see what their workflow is like and translate that into improve my EHR, improve the way I deal with my population health thing, you know.
Yeah.
You know, that's actually an under appreciated skill, I would say. And it's going to be one where I think optimizing the way we use health IT is going to be one of the major things that I think we take on in the next several years. We've gotten to a lot of adoption, but we're not optimizing stuff well yet.
No, not at all.
We have one more question that just came in. Do you have advice for a current graduate student in health informatics looking for an entry-level work? I have a background in psychology and bedside patient care, and finding jobs that are truly entry-level while self-studying more within the data science realm has been difficult since my background doesn't really align with anything I've seen so far with job requirements.
So I think, you know what, for that, if you're looking for a position like that, I don't necessarily think that your background doesn't lend itself to doing something in that field. You know, one of my previous jobs, I was the IT person for UMass Memorial Healthcare. And I had an entire staff whose job it was to work with data, right? And really help the rest of the organization consume it, organize it, and then kind of feed it up to them to, you know, do predictive analytics and all kinds of different types of things. And, you know, that's the kind of person that, you know, could come in on the ground level and could actually learn. Many organizations, if you get in the ground level like that, will send you to school and will get you certification. So you can get in on the ground level of a job and start to learn there and get the experience there. And I think there's lots of opportunity. There's lots of opportunities. When I was hiring people, when I was in that role, I couldn't fill the positions. There just wasn't enough people, and because there were high demand roles.
I would add that I would also self-examine, are you really actually an entry-level person with those skills? My suspicion is you may not be an entry-level person, and that you're looking for an entry-level job with skills that may actually, that you might actually be a mid-level individual. So don't one of the things to be careful about is underselling where you're at. If you're just graduating college and you're just, coming out into the world for the first time with jobs, that's your entry level. But if you've got some other professional background that you're bringing to bear, and then you're adding a degree on top of that and some, internships or something else, you're generally not an entry level individual.
Right. That's a good point.
And I would, clearly, obviously agree with that. And I think there's so many ways that you can go with this. I use the example, like we've had analysts on our Epic team who go onto our data analytics team. They go onto our integration team. It's really just about getting a foothold. They go into our nurse informatics team. There's just so many directions you can go once you're at a healthcare organization. Within IT, without IT strategy, there's just so many different places to end up. And I think, like Tom said, to kind of sell yourself short with that clinical background is not doing yourself any favor. So I would definitely check out positions that are not so focused on like the health science side, but maybe more on like the workflow and using your clinical background first.
Yeah.
And that can slowly change over time too. So where you're at right now and looking for a job, the first one that you get there on after, it's a starting point to where you want to be. It's not a necessarily be all end all. It's evolving, we're always growing. I remember when I pivoted out of a completely different industry into healthcare, I started in something that would just give me the opportunity to really just grasp what they're really trying to accomplish in EHR sort of field and understand the terms and the workflow and things like that. And then, a year or two later, rethink that and see if maybe you can take that and transition elsewhere. But I do hear what you're saying. You're trying to really get that first one out of the gate. So thank you everyone for your advice on that.
Yeah.
How are we looking, Katie?
We're good.
Okay. So in terms of other questions that we have, and we might have, I think we've overlapped on this a little bit. We talked about qualities of a new hire, and I think we really mentioned, you want to stand out in specific ways and be a go-getter. In terms of being a go-getter and being current, what blogs and literature does one recommend to stay on top of the latest industry trends? I know that you can always go on Google and do a quick search and look for different articles that are relevant and within the last week or two. Are there specific sites related to Himss or other healthcare IT websites that you go to, or blogs or books even?
So I'm a big advocate of subscribing to a lot of different things, and I read through stuff every day. So my advice is, these are my top go-to. The first is go to the Centers for Medicare and Medicaid Services, CMS. If you go to CMS, they will send you updates. If you want to keep ahead in this industry, you need to stay on top of the regulations and see what's coming down, see the changes in Medicare and Medicaid. Any of those, HHS.gov is also a place you want to go, because that's where a lot of the different things will come through, like interoperability, the changes on the ONC for the interoperability, that will come through. Healthcare IT news, that still comes in paper format if you want it, but it does come online as well. Any of the Fierce articles, they have Fierce IT, Fierce EHR, those are all a great read. EHR intelligence and health IT security. So I've worked in a little bit of security too. So that's of interest to me. If you need one great online tool, it's called Healthcare Dive. Healthcare Dive goes out and sweeps all the other articles online and breaks it down by hospitals, payers, providers, a couple other categories as well, and brings forward the top articles of the day. So if you have a limited amount of time and you really want to get it, subscribe. It's free. Subscribe to Healthcare Dive, and it'll be delivered to your mail every day, and it'll have the top articles. I find if I go through that and get the government sites sent to me, I kind of keep abreast of kind of all the changes that are coming forth.
Well, you got a load of them, Renee.
I know, I'm one of those junkies that oh, I found that article really interesting. Do you want to subscribe? Oh, okay. And so, yeah, I do have quite a bit that I do, but that's why I suggested the Healthcare Dive. If you don't want to get all those in your inbox, that's a great one to kind of sweep.
Yeah. The other thing that if folks are interested in sort of the educator's perspective on stuff, one of the folks that we mentioned a little earlier, Bill Hirsch, who runs the Oregon Health Sciences University program. He has a blog called the Informatics Professor, I think, something I could look at it. It's called informaticsprofessor.blogspot.com, and he actually does a pretty good job of giving sort of summary from like what are the workflow, what are the workforce analyses that's come out recently, a little bit about evidence and other things like that, and that's actually not a bad site for folks who are interested in that.
Mm-hmm. Yeah, absolutely.
In the chat, there's a couple of networking links that everyone is mentioning. I've also included our New England Hymns LinkedIn chapter for folks to follow that as well. We have one more question. This one is from someone saying, I'm a math person and interested in healthcare analytics. Should I focus in health informatics or health management for graduate school?
I think I'm gonna take a stab at trying to understand what the person's really saying, but I think if you're interested in sort of true analytics, I'm not sure health information management is the best place for you. I think you're going to get in health informatics a much broader view of things, and it's not going to be as focused on some of the legal and the other aspects of it. And you can actually take, for example, if you're getting a master's degree, you can actually focus on healthcare analytics in some of the master's programs, more so in the health informatics or biomedical. The other term to use is biomedical informatics. Some of the programs are called that. A good way to sort of get a really quick overview of what various different healthcare programs offer is maybe consider looking at what they call AMIA 10 by 10 programs. So the American Medical Informatics Association has something called the 10 by 10 programs. They're 10 weeks long. They're not that expensive, maybe $2,000, $2,500. You get a certificate at the end of them. You can get a broad perspective from anything from public health to sort of informatics in general to analytics. They have a variety of different courses that you can kind of take that way. So that's not a bad place to sort of just go sample what might be out there.
Yeah, I would agree. I think if you want to be an informed manager who can sit at the table with the quants and understand what's going on, maybe a health management degree might be the way to go. But if you're looking to be an analyst who is modeling, for an organization and setting the strategic path, I think more of like an actual data analytics master's program may be more in line with what you're looking for. Especially because if that's your true passion, you could translate that to other industries, in the end, if you decide to move out of healthcare.
And if you're really looking for artificial intelligence kind of analytics, that area, some of those are really in computer science programs too. So some of that may be in depending on how techy you are, that may be actually really want to look where you want to look for things.
You know what? I don't consider. I've been in health IT for a long time, and I don't consider my background, my education to be super technical. My undergrad, I was a sociology major, so there's that. And when I decided to, and I've done a lot of great things in IT. I've built private HIEs. I've done really fun stuff, right? And I've learned a lot. And I also got some training and some certifications and some stuff, but I preferred the management route. So one of the things you can do as you become familiar in this field and you start to work, I mean, there's nothing wrong with deciding you want to pull back a little bit and go into more of a management function. I actually like leading teams, solving the problem of health IT, and then building the solution around it, right? And then finding the right people to do it. To me, that's my mentorship, right? That's where I like to come from. And so when I went back to school, I actually opted to get a master's in business. So I got an MBA, which is a little bit, you know, I mean, it's pretty mainstream now to have an MBA, but I also think it helps see perspective, especially if you're going to kind of take the route that I did. So very different approach than what we're talking about here. But if you decide to go into management someday, you know, that is also a helpful path.
I think this one, there was someone asking about that 10 by 10 program that you were mentioning, Tom, and how to find that.
I'll put it up in the chat.
Great, thank you. And one more question: what job profiles should a health informatics student look into?
So I think I can speak for obviously my background. I think electronic health records positions. So many of the students in our program, health informatics program, go on to, you know, careers working with Epic, Meditech, Cerner, you know, as analysts at healthcare organizations, whether it's, you know, at a vendor or at a healthcare organization. So, you know, application analyst positions, if you're looking for that type of role, you know, there's many positions that are usually out there. These days they're becoming more competitive, but it's definitely something to look just by going on the healthcare organization's websites and looking through their open IT positions, or like I said, through LinkedIn or other avenues, networking.
To tack on to that, Dan, are there certifications related to those roles, or can one go into it without any sort of sponsorship of that sort? I know Epic sometimes does offer certain certifications.
Yeah, those are normally sponsored through the organization. It's very rare that Epic would certify like an independent consultant. I think they used to, but they're more because of, you know, staff retention issues with Epic certified analysts. I think they're moving more in the avenue of actually certifying through the organization rather than like an independently funded certification. But yeah, those usually come after the position. And speaking for my organization and other organizations, normally you wouldn't need, I mean, a master's obviously helps, but I think a lot of entry-level jobs, if you show an interest in healthcare and you have a good background, then you know, from an education standpoint, then in those positions are definitely attainable.
Nice.
We have one more question coming in. Actually, this one was for Renee, if you've ever heard of a topic called servant leadership. It's a great topic for management and a more realistic take on it. Oh. You're muted, Renee, sorry.
There we go. There you go. Actually, I do know quite a bit about servant leadership, and one of my classes that I teach at Southern New Hampshire is managing and leading in business. And we talk about servant leadership and about different types of leadership styles. I actually am looking in my office at the book that I have on servant leadership. It's right across from me. So I'm very familiar with it. I'm a big proponent of it. It's definitely a mind shift from what we might consider traditional leadership.
One more for you, Renee. What made you go for your MBA from being a sociology major during your undergrad? How did you get into the healthcare industry?
All right. So really funny story. This is the entertainment for the night. So when I went to college, I didn't know what I wanted to do. So I was a sociology major. In fact, my first computer class that I took, I flunked. It was the only F I've ever gotten in my entire life. I was a straight A student, right? I got out of college and I went into finance, and a colleague of mine left and went to Bay State Health and called me up one day and said, "Hey, do you want to be a business analyst in healthcare?" And I'm like, "Okay, that sounds like a great idea." And I was young, I didn't have a family, and they're like, "Oh yeah, it pays a consultant. There's no healthcare benefits." And I'm like, "Yeah, I don't care," right? So I did it, and I walked in there, and I loved it. I just saw the potential. When you come from financial services, you could see how much more advanced it was from a technology perspective. You could see in healthcare just a limitless opportunity to develop it. And I just fell in love with it. And so I progressed my career through there. I was a business analyst, and then I was a project manager for a long time at Bay State. And then I opened my own consulting company and worked with a lot of big hospitals in Connecticut and Massachusetts on HIPAA when that first came about. And I kind of grew from there. And I've always been fascinated by healthcare and the changes in healthcare. And I think one of the things that keeps me motivated on it is that we have to fix it because it's not working. And I think one of the biggest influences in that is technology. How can we use technology? How can we use data to influence the changes we need to make in healthcare? So that's kind of how I got to that journey. I do think being a sociology major did really help me because it's study of groups, and certainly along the way in your journey in your career, you will meet a lot of different groups of people, and it teaches you how to have a good understanding of it. And somebody just mentioned, Renee, I got an MBA. I teach at SNU. My MBA is actually from Bay Path University. So, but SNU is a great school. Love it.
Great. Thanks, Renee. We actually got a question for Dr. Agresta. How did you find clinical informatics? And how did you decide to get your board certification in clinical informatics?
So like many, my journey wasn't exactly a straight line. I have a background, I have an undergraduate degree in biomedical engineering. So I have an engineering degree, then I went into medical school, and then probably because I'm the oldest of 10 children, I ended up in family medicine, right? But I never lost that sort of interest in technology. And I'd done a little bit of computer programming in college. And you got to understand, when I computer programmed, I took punch cards down to the computer, to computer room and ran them. So this was a very different era of computer programming. And so as I was a faculty member, I was trying to introduce things like handheld computers at that time, Palm Pilots and very early things into medical education. And so I was trying to introduce these things into medical education. Eventually I ended up running into somebody who said, "Well, do you know about health informatics? Do you know about this?" And I got engaged in the AMIA 10x10 programs, and eventually got a master's degree through the Oregon Health Sciences University. Really switched from being a medical educator to being a health informatics professional. And so that's that transition that kind of occurred for me. And as I was involved in the AMIA, this whole concept of a specialist in clinical informatics was being discussed around how we would, certify people for having the skill set. And so I actually ended up volunteering or getting picked to actually help write the clinical informatics board exams. And so I've been spending the last 10 or 11 years of my life writing board exam questions and helping people get certified. So I was one of the first 10 people in the country certified just because of that process. So it was a long, circuitous journey, as most careers are. They have multiple stops along the way.
One more question, then we'll go back to some of the questions you have, Monique. So I am studying health informatics with certifications in medical billing and coding. What opportunities should I pursue? Read it one more time. I'm studying health informatics with a certification in medical billing and coding. What opportunities should I pursue?
This sounds like someone who would benefit maybe from being in the health information management.
I was just going to say HIM.
Yeah. So the HIM, the health information management departments of most healthcare organizations, do a lot of this. They need to understand how coding and billing occurs. They need to understand also some of the legal and privacy and security issues that are related to healthcare data, et cetera. And they're often part of a clinical, they can either be part of their own department, or they can be part of an informatics group. I don't know, Dan, in your organization, how they're connected to the Epic group.
Yep. So I can briefly, so we have a coding team. We have internal coders, we have external coders. Some of our hospital billers are internal, and they're more like consult with our health informatics teams. So when we're building new documentation, like an example is like moderate sedation, not to get too into the clinical side, but we needed to work with them to make sure that like the provider face-to-face time was documented appropriately so that we could bill correctly. An IT person who's building a document isn't going to know that. And so to have that person whose background is in billing and coding is obviously essential to the revenue cycle, aspect of the organization. And I was going to say another takeoff on that is there are like revenue cycle teams within EHRs. So there's the whole clinical side of it, then there's the professional and hospital billing. And so that could be another avenue. It's not necessarily, directly related to billing and coding, but that is, if you're looking to get into the more like EHR, IT side of it, that's another avenue that you could explore.
And actually, I was just thinking about this from the standpoint of understanding those things. You would probably be a good fit to be part of an analytics team looking at like claims data that was being used. And so you could, use that skill to understand how medical claims you can do predictive analytics with medical claims. You can do a lot of, a lot of things with medical claims, especially now in the world of health information exchanges where you're getting data from multiple different settings together.
Also be good from an ACO perspective, probably, I'm assuming.
I work hands-on with that every single day. I actually worked with one of our coders today to work on a specific issue, but that background is very specific, but also very much in need because realistically, you can have the outside vendors and that's great. We go back and forth and we'll email them, but to have somebody internally makes a huge difference. As Renee was talking about, CMS are constantly changing their rules in terms of coding and things of that nature. So that flows downstream to us in billing. And we're always making updates in terms of logic and edits internally in the system. So working hands-on with an Epic or other EHRs, as a matter of fact, revenue cycles for, every sort of hospital entity there is. We need to get paid. That's our goal. So there's Cerner, there's Meditech, there's Athena that also does billing. So that's right here in Watertown in Massachusetts. There's plenty of different options. It's really becoming familiar with the product and if it's a culture and an environment that you'd really want to work in. It's very busy. There's a lot of volume depending on where you work. So there's plenty to do.
Just one other thought process that everybody can think about in terms of where opportunities might lie is that there's a huge crush on the market right now for companies that are from startup to mid-level of healthcare tech. It's like unreal how many companies are out there now that are focusing on value-based care, APIs, delivering apps to phones. It's endless. I mean, it's like 15 years ago, there were no EHRs, or there was a million EHRs, and then they've kind of skinnied the market down. So if you're a big hospital, you're Cerner or Epic, and if you're mid-size, you're Meditech, and ambulatory has a few as well. But the market now on these new technologies is like burgeoning. And I mean, there's so much opportunity there. I mean, these startup companies give you, one, the ability to use your skills, your analytical skills, because they're developing things that hospitals need, that patients need, that organizations that provide healthcare need. And they also provide very cool environments to work in, a lot of flexibility, opportunity to be on the ground to help build it up. So I think, and a lot of them are involved in collecting data. And once you have data, data needs to be mined, it needs to be analyzed, it needs to be, monetized or whatever they're doing with it. So there's an area to start to look at. And, Boston certainly has its fair share in that part of the country, but there's a lot of them that are out there. So if you're looking around, that's a segment you could kind of narrow in on.
Great, thanks everyone. Over to you, Monique.
Okay, so we're looking at 6:12 right now, and I just want to be mindful of the time. So this question is for our faculty. Tell us a little bit more about your program. We heard about yourselves, what courses are offered, and what do you teach, and what really makes your program unique?
So I'll start, Tom and Dan, they're more focused on the clinical informatics side. So transparency, I am obviously adjunct at SNU, and I don't really focus specifically on healthcare informatics. However, I have a strong, my background will, the classes that I teach lend itself to project management. We talked about that very early on in there about what's a strong class to have or a strong background, and project management is certainly one of them, no matter what you're doing. That's always good. And then managing and leading business. So my focus is on those who might want to lend themselves to more, management and leadership positions. And so those are the kind of areas that I focus on in my organization, and also business planning, which is usually a more of a challenging course because you're developing a whole business plan. So that's where I focus on.
Mine could be easy. I'm a faculty at the medical school, but I'm not really teaching, courses in health informatics. What I tend to end up doing is giving lectures and helping with continuing medical education and continuing professional education activities. So I'm not teaching specific coursework, but there are other programs out there that do have clinicians as part of their teaching faculty. So at most of the major health informatics programs in the country, there are some clinical faculty who are participating in that.
Yep, and just a little bit about my program. So originally it was developed more for like the kind of the mid-level manager in mind who was looking to go back to school to get a master's. Lately, we've, as the industry has, people have been a little bit more interested in the industry coming straight out of undergraduate. We've seen more, master's candidates coming right from undergrad. So our program is basically around like healthcare data, organizational leadership, so more in the management, some of the management track. There's also some electives if you want to get down like the biomedical statistics, that type of stuff. So as I said, more created for the manager, but kind of now leaning more toward the recent graduate as well.
Great. And just to kind of end on that note, with everything that you're seeing with participants and students in class and everything outside with the COVID, are there certain topics or hot button items that students should really be focusing in on? Any keywords, buzz sort of conversations that they need to kind of leap into to help them connect the dots?
I think if you could really do telehealth well, you're going to be a great asset to an organization. That's one thing I can tell you that everyone started. We've all kind of pulled back now that COVID slowed down in the area, but you know where the trajectory is going, and so telehealth's going to come back. But I think the issue is that it's not just going to be telehealth for the purposes of get on a video and have a chat with a clinician. I think we're really going to be in a transformational way, kind of also bringing in remote patient monitoring activities with that, and actually starting to manage chronic diseases where telehealth actually becomes a real basement part of, what a healthcare organization, even a small, clinician practice has to do we're really in a transformation time frame, and I think there's a lot of room for improving the way we do stuff now, ranging from workflow to improving the solutions to integrating them with, other technologies to, for goodness sakes, getting laws passed that are appropriate. And all these things are stuff that you can work on it with these backgrounds.
Yep. And I think as a basis to all of this work, I think one thing that we've noticed is that equity is now like a central feature of any work that we do. So telehealth, I work at a safety net hospital. How do we extend this to our patient population? It's not enough to just extend it through your patient portal because maybe your patients don't have access to a smartphone or a laptop. And so I think that needs to kind of be the frame around everything that we talk about through technology, is access to it, and how can we be equitable about extending some of this technology that we're working on. So that's definitely been a trend that I've seen that's been accelerated as a result of COVID.
The other thing you can think about too, that's, hang on, there's somebody who asked me a question, so I'm trying to reply. The other thing you need to think about too, and this is tangentially related to it, but it does require some understanding of it. If you're gonna, telehealth and all that, it's all great. We've seen great advances over the last, several months, right? So there's two things. One thing to think about is the increase in cybersecurity risk. There's data flying all over the place, right? So really understanding, going into an organization and kind of understanding where PII is and PHI is to understand what kind of risks the organization is at. Huge growth in that field. So, data scientists are always welcome in that area. The other thing is, and this is a personal thing, a personal passion of mine, is I always believe that healthcare is treating disease. And that's why it's so expensive, and that's why it's so untenable, because people just keep getting sick and we just keep throwing money at it. I'm a project manager by background, right? If there's a problem, I tend to look at root cause. What is the root cause? And I think that's one of the areas that we've lacked in healthcare. We have not looked at the root cause. One of the things we're starting to do is looking for things like social determinants of health. So really, that is the root cause of healthcare. What is making people sick? Is it because they live, they don't have access to good food? They don't have access to a consistent home. I'm a firm believer, if we can understand that data and gather that data, we'll be able to fix things before they get broken. And then that will change how healthcare is delivered. So if you really want to talk about some really cool ways to analyze data, look at for social determinants of health, because that will tell you a lot.
Thanks, Renee. We have a question. So I am a dental surgeon and practiced for a year and a half and pursuing an MS in health informatics from Northeastern. What courses should I take in the technical arena that will get me a good internship? Also, what growth can one expect? Also, if there are any research opportunities you see in that area, maybe AI or machine learning, and how effectively it can be used in management of chronic diseases is that person's interest.
So I can't speak in detail about this, but one of the things I would recommend, based on your description of what you're doing, is look for internships or opportunities at a medical school, because they're going to have a research arm. So for example, when I read some of this stuff, I know that like UMass at our medical school, they were looking at some of this stuff with AI and machine learning. So you might pursue opportunities there at the school to see if you can get some internships or, opportunities to work in the organization to use some of that stuff.
I would agree. And given the fact that you're a dental surgeon, dental schools actually also might be interested in some of these things.
Yeah.
The most, from my understanding right now, most of the dental practices, even if they have an electronic record keeping system, an electronic dental record, they're really not connecting in and connecting to other healthcare organizations through any kind of health information exchange activities. I think there's a enormously wonderful opportunity there to start connecting that, because as we all know, there's an awful lot of times where kind of transferring patients back and forth, and we're duplicating efforts, and the patients are duplicating medical histories, et cetera. So I think there's a real opportunity there. There's opportunities with thinking about clinical decision support in a dental environment, and then sort of the healthcare analytics that exist in dentistry is, I think, could be paired actually very effectively with the clinical healthcare analytics to think about, what kinds of dental disease are caused by or cause certain kinds of medical conditions. And there's a real opportunity, I think, in those settings as well.
I would go even further to say that not only is there not like an HIE or a connection between organizations, a lot of times the dental at one organization is separate from the medical at the very same organization, and they don't talk to each other due to the nature and history of the big vendors in the dental space. And so as we see more of the EHR on the medical side go into the dental side, I think there's a good opportunity there to work on the integration of the dental and medical within a single organization. I think that's something that I'm seeing in especially our community health centers, which are more kind of offer everything on under one umbrella. So
great, thanks everyone. We have about 7 minutes left, so if you do have any more questions, feel free to put them through the chat or ask them directly as well. I wanted to kind of pivot off of a question that Renee had answered in here around project management. If we're seeing demand for PM positions in the healthcare right now. I can actually speak to that one a little bit too. I work for an IT healthcare staffing company, and we are seeing a lot of project management opportunities on the IT side right now, both on the application side and on the infrastructure side. Actually, the other day we were working on a technical project manager position for a vaccine disbursement. Which is, of course, as you can imagine, that was COVID related. So I feel like there could be potentially more coming down the pipeline as well. But for other implementations, we do see a lot of project managers. So definitely keep an eye out. I think that's a hot area as well for a lot of the projects coming down. So this one is one more question. This is geared towards Renee. I am currently a freelance writer that leans on evidence-based nutrition and health. I have a master's in nutrition that took to writing. After a gap of 10 years, I am trying to switch gears and into health informatics. I am pursuing an associate's degree in HIM in a community college to get a feel for things. What is your advice for me? What you shared on evidence-based medicine resonated with me.
Okay, well, I'm not sure I was the one that answered on the evidence-based medicine, but I'm currently trying to switch. What's your advice for me? That's writer. So I think, it looks like, you're going in the right direction, right? You're going to get this degree in health informatics. And if you're looking for an area to pursue, definitely look towards, maybe a healthcare organization like a health system, right? That has an entity that looks at this kind of data, that aggregates data, that pulls data out. That you could, actually use some of your background in nutrition and health to develop that. I think, when I was at ECHN, I managed the health information management folks, and that's also an opportunity as well. If you're looking to get into that field, you could leverage some of that as well there. So I would kind of look in those areas. You might be able to find some opportunities there where you can leverage everything that you're working on here. But one thing that you brought up that I think is kind of an interesting thing, you mentioned that you're a freelance writer, and this goes for you and for all everybody on this. one of the things I think helps get you networked and noticed, you obviously have freelance, you've written before, so you're comfortable with that. But if you can publish, I think that's a great way to get yourself noticed. It doesn't have to be super complex to start. The other thing you can do that goes along with that is if you get opportunities to speak. I mean, the first time is brutal. It's unnerving to get up in front of people. But I think those are also opportunities to get yourself recognized and get yourself networked out there. So it's just a couple other pieces of advice that, I would recommend.
Thanks, Renee. We have one last question that came in. What can I do better to prepare my resume and myself when I start applying for jobs in about a year from now? Specifically, is there any certifications or classes I should have before applying as a healthcare administrator? I have heard word to mouth that there is a certification in Massachusetts for healthcare administrators, but I have never been able to find further information on it. I suppose in addition to that, where could I find reliable information on what is required?
Are you talking, so if you're doing healthcare administration, can you be more specific? Are you talking about managing a hospital? Are you talking about managing an assisted living facility? When you say healthcare administration, are you talking about if you're going into just general management in a healthcare organization? A master's in public health is always a good opportunity.
Nursing homes or assisted livings?
You know what? I would say the best way to figure out how to do that is to connect with someone who works in an assisted living facility or a healthcare. Call them up, interview them on the phone. Where did you go? Where did you get certified? What is your career path? Don't be afraid to call someone up and ask them, what is their best recommendation? I work tangentially with skilled nursing facilities and things like that in terms of data, but call them up to ask to speak to the administrator. Say, I'm a student, I'm going back to school, I'm learning this. How do I get certified? And we can take that offline too. Maybe we can, Monique and Katie, we have a list of questions. Maybe we can figure out where that is and let people know what those certifications are.
Yes, that sounds great. If we didn't get to your question, we'll certainly note it down and we will be sure to reach out to you. But I just want to thank you everyone for joining this evening. I hope everyone found it informative, worthwhile. And we appreciate all of the insights and the conversations and the questions that everyone asked. It was really engaging. We will be sending out a survey that will be sent out tomorrow. So we appreciate any feedback that you can give us. There will also be some other events that we will hold coming up that I just kind of want to put a plug in for. We have our November 12th virtual event coming up next Thursday. It's called Prioritizing Healthcare Information Technology for an Unpredictable Tomorrow. This is in collaboration with New England Himss as well as Alabama, Mississippi, and Southern California chapters of Himss. It's going to be a virtual event. It's an all-day event. You can pop in and out. There's games, there's prizes, and a great opportunity to listen to some informative speakers and some networking opportunities there. We're also going to be posting on our website a holiday social on December 3rd from 5 to 7. So be sure to keep an eye out for that. And to close out the year, on December 22nd, we're going to have another speaker, Dr. Megan Rainey. I don't know if has a lot of things published. So she's going to be speaking on digital health technology to maximize health and eliminate disparities. So we have our save the date posted on our website. So more information to come on that. I just kind of wanted to direct everyone to our website to check out some other opportunities that we have coming up. But with that, I will end it there, and I hope everyone has a nice evening, and thank you again for joining.
Hi, everyone.
Thank you, everyone.
Thanks, everyone.
Bye-bye.
Thanks for joining, everyone.
Thank you. Bye.
Yeah.
Thank you.